Welcome to Rwanda Medical Academy. Today's lesson is about common causes of hematuria. Ever wondered what causes blood in your urine? That's a condition we call hematuria. Hematuria simply refers to the presence of blood in the urine, which can range from being barely visible to the naked eye to being clear and bright red. It's not a disease in itself, but rather a symptom of an underlying condition. Just as a cough can indicate a cold or a more serious lung disease, hematuria could be a sign of minor issues or more severe conditions. It's crucial to take hematuria seriously, as it's usually the body's way of signaling that something isn't quite right in the urinary system. This could be anything from an infection to a stone, a trauma, a tumor, or even tuberculosis. Now that we know what hematuria is, let's dive into the common causes. Use the mnemonic SITTT to help you easily remember common causes of hematuria. The first S in our mnemonic SITT stands for stone. Now, when we talk about stones in relation to hematuria, we're referring to kidney stones and urinary tract stones. These are solid masses composed of crystals that form in the kidneys or other parts of the urinary tract. You may wonder, how do these stones contribute to hematuria? Well, when these stones pass through the urinary system, they can cause irritation, inflammation, and sometimes injury to the lining of the urinary tract. This can lead to blood in the urine, which is what hematuria is. Imagine the urinary tract as a series of tubes, and these stones are like tiny, sharp pebbles moving through those tubes. They can scrape against the sides, causing discomfort and sometimes bleeding. The size of these stones can vary, from as small as a grain of sand to as large as a golf ball. Smaller stones are more likely to pass through the urinary system without causing symptoms. But larger ones can be quite painful and cause more damage. The process of stone formation is complex. It involves a combination of genetic factors, dietary habits, and overall health. For instance, not drinking enough water can increase the risk of stone formation, as can a diet high in protein, sodium, and sugar. Certain medical conditions like obesity or inflammatory bowel disease can also increase the risk. So how do we know if stones are the cause of hematuria? Well, in addition to blood in the urine, other symptoms can include severe pain in the side and back, below the ribs, pain during urination, and frequent urination. If these symptoms are present, healthcare professionals may use imaging tests like an ultrasound or CT scan to look for stones in the urinary tract. So stones can indeed be a culprit for blood in the urine. Understanding their role in causing hematuria is a crucial step in diagnosing and treating this condition effectively. Next, we have I, which stands for infection. In the context of hematuria, this refers to urinary tract infections or UTIs. UTIs are a common health issue affecting millions of people every year. They occur when bacteria enter the urinary tract, often through the urethra, and begin to multiply. This can cause inflammation and irritation in the urinary tract, which includes the bladder, urethra, and sometimes the kidneys. Now you might be wondering, how does an infection lead to blood in the urine? Well, it's all down to the body's response to the invading bacteria. As the immune system fights off the infection, it sends inflammatory cells to the site. These cells can cause damage to the lining of the urinary tract, leading to bleeding and subsequently hematuria. Another aspect to consider is that the bacteria themselves can also directly damage the urinary tract. Some strains of bacteria produce toxins that can harm the cells lining the urinary tract, leading to inflammation, irritation, and bleeding. It's also worth noting that UTIs can affect various parts of the urinary tract. A lower UTI, for example, affects the bladder and urethra, while an upper UTI affects the kidneys. Hematuria is more common in upper UTIs, but it can occur in lower UTIs as well. What's important to remember is that while UTIs are common and often easily treated, they should never be ignored. If left untreated, a UTI can lead to more serious complications, including kidney damage. And so we see how infections, particularly urinary tract infections, can lead to hematuria. They cause inflammation and irritation of the urinary tract, leading to bleeding and the presence of blood in the urine. Infections, thus, can cause blood in the urine. The 3 T's in our mnemonic stand for trauma, tumor, and tuberculosis. Each of these can be a cause of hematuria, and we'll delve into how they each play a role. Let's start with trauma. Unfortunate as they may be, accidents happen. Falls, sports injuries, or direct blows to the abdominal or pelvic region can all lead to trauma of the urinary system. When such injuries occur, they can cause damage to the kidneys, bladder, ureters, or urethra, resulting in hematuria. This blood in the urine can be an important indicator of the extent of the injury, and therefore should never be ignored. And next we have tumors. These are abnormal growths that can occur in any part of the urinary tract: kidneys, bladder, ureters, or urethra. Tumors can be benign, which means they are not cancerous, or malignant, which means they are. Both types can cause bleeding into the urinary tract, resulting in hematuria. It's also worth noting that hematuria may be one of the early signs of urological cancers, such as bladder cancer, kidney cancer, or prostate cancer. This is why, while it may be discomforting, it is crucial to seek medical advice if you notice blood in your urine. Lastly, let's talk about tuberculosis. Often thought of as a lung disease, tuberculosis can also affect the urinary tract. Genitourinary tuberculosis is a form of extrapulmonary TB that affects the urinary system. It can lead to inflammation, ulceration, and bleeding in the bladder or kidneys, causing hematuria. While this form of TB is relatively rare, it's important to keep in mind as a potential cause, particularly in areas where TB is prevalent. And there you have it. The 3 T's in our mnemonic: trauma, tumors, and tuberculosis are all potential causes of hematuria. Each brings its own set of challenges and considerations, but all are important to recognize and understand. So, trauma, tumors, and tuberculosis. Round up our list of common causes. Remember, hematuria is often a sign that something is not right within the urinary system. It's always worth seeking medical advice to determine the cause and get the right treatment. Your health is worth it. With our mnemonic SITTT, we can easily remember these common causes of hematuria. We've explored a variety of factors that may result in hematuria, or the presence of blood in urine. This complex condition has multiple causes, which can be conveniently recalled using the mnemonic SITTT. First, we discussed how S stands for stones. These are crystalline solid masses that form in the kidneys or other parts of the urinary tract. When these stones travel through the urinary system, they can cause irritation, inflammation, and even injury to the urinary tract's lining, leading to the presence of blood in the urine. Next, we examine eye for infection. Urinary tract infections can cause inflammation and irritation in the urinary tract, including the bladder, urethra, and sometimes the kidneys. The presence of inflammatory cells and damage to the urinary tract's lining from these infections can result in hematuria. The first T in our mnemonic refers to trauma. Accidents, falls, sports injuries, or direct blows to the abdominal or pelvic region can cause injuries to the kidneys, bladder, ureters, or urethra, resulting in hematuria. The second T stands for tumor. Tumors in the urinary tract, benign or malignant, can lead to bleeding into the urinary tract. Hematuria may be an early indicator of urological cancers, such as bladder cancer, kidney cancer, or prostate cancer. Finally, the last T represents tuberculosis. This disease can affect the urinary tract, leading to inflammation, ulceration, and bleeding in the bladder or kidneys. Hematuria can be a manifestation of genitourinary tuberculosis, a form of extrapulmonary TB that affects the urinary system. In conclusion, SITTT serves as a useful mnemonic to remember the common causes of hematuria. These include kidney stones, urinary tract infections, trauma, tumors of the urinary tract, and tuberculosis affecting the urinary system. Remember, identifying the underlying cause of hematuria is essential for appropriate diagnosis and treatment. Keep SITTT in mind when considering possible causes. Thank you for learning. At Rwanda Medical Academy, knowledge is power and value.